Hello everyone, I am Dushyant Magu from MedSurge India. Did you know cervical cancer is the fourth most common cancer in women, claiming over 300,000 lives worldwide each year, mostly affecting women between the ages of 35 and 44 years. This silent killer can often go unnoticed, but you have the power to protect yourself with regular screenings and the HPV vaccine. Currently, we are joined by Dr. Ashok Kumar Vaid, who is working as chairman of Medical Oncology at Medanta Cancer Institute, Gurugram. Welcome, doctor.
Hi.
Now, let's discuss more about cervical cancer.
Hi, everyone. My name is Dr. Ashok Vaid, and I'm an oncologist at the Medanta Hospital in Delhi, India. And I've been practicing at Medanta for the last now almost for 15 years, ever since this hospital began. And we have treated a large number of patients coming from overseas, and which includes patients coming from Africa, Southeast Asia, and Central Asia as well.
Dr. Vaid, what are the early signs of cervical cancer that women should watch out for?
There could be, first and foremost, no symptoms at all. And there could be very minimal symptoms in terms of a woman might have some discharge, or in later stages or later phases of the disease, there may be bleeding, spontaneous, and sometimes after a sexual act, which we call as a postcoital bleeding. So women should not ignore bleeding which happens in between two cycles or happens after the postcoital bleeding, what we call as, and there could be just a discharge.
How important is regular cervical cancer screening, and how often should women get tested?
Absolutely important. This is one of the preventable cancers, amenable to very early detection. When I say preventable, prevention is by way of vaccination, which can be given to all girls above the age of 12 years up to getting sexually active. However, even after that, up to age of 45, women can still take cervical cancer vaccine, and it prevents largely a large number of cervical cancers. So that's preventive. Early detection, as I said, is by way of the regular checks, pap smears, and one would recommend on a very periodic basis. Ever since after the onset of sexual activity, women must visit the gynecologist once in a couple of years to get the pap smear done.
So, doctor, what is the biggest recent breakthrough in cancer treatment?
Many of them, and broadly one would say that with the better understanding of the biology of cancer, we are able to develop better therapies, better treatments, more targeted treatments, and immunotherapies. And that is all as far as the drug treatment or the medical treatment is concerned. The surgical efforts have become much better, and the surgical approaches are actually more pro-patient today. Even the radiation techniques, some of the patients who would receive radiation for treatment of the cervical cancer, the radiation techniques have become much more safer, more patient-friendly. Broadly, the treatments are more patient-friendly and less toxic as of date, and the science is moving more towards developing targeted and more patient-friendly drugs and medications.
How does India's cancer care compare to Western countries regarding technology and, of course, affordability?
The health infrastructure in India has become very robust. There are modern hospitals, many of them. Every big city has many well-equipped and well-manned hospitals. The doctors are at par with professionals anywhere in the world. And then we are letting out world-class treatments with world-class infrastructures to back us. And then we are proud of that fact. Much more affordable. And as I said in the beginning, that the overall health scenario in India has become much better. and we are getting medical tourism, patients coming from almost all parts of the world, even patients coming from Europe and North America as well.
Alongside Dr. Ashok Vaid, we have Miss Diana from Zambia, a courageous cervical cancer survivor who traveled all the way from Zambia to India for life-saving treatment under his expert care. Welcome, Miss Diana.
Thank you very much for the opportunity.
Can you share the story of Miss Diana, a cervical cancer patient from Zambia?
Thank you for giving me the opportunity to be involved in the care of Diana, who came from Zambia, all the way from Zambia, seeking treatment for her cervical cancer. And as the story goes, Diana had a surgery on the uterus done about a year back, and presented to us with bleeding and other symptoms, which we figured out that this was related to a tumor, and the biopsy turned out to be a malignant tumor. And that's generally the protocol an oncologist would employ. To make things simple and understandable, the oncologists work in 3 steps. And that is true for any problem solving. You need a diagnosis first. As the treating doctor, I should be sure what's the disease I'm treating. And Diana came without a diagnosis. So my first job was to establish a diagnosis. And whenever there's a suspicion about a tumor, the best way to know whether it is malignant or not is to take a biopsy, which is a small bit of tissue we take from a relevant area, put it under the microscope, and the pathologist tells us what is the type of the tumor or the tissue that represents in that. So that's exactly what we did for Diana as well. We ran a whole body PET scan to stage the disease. That's how we got to know that what type of tumor Diana has and what's the stage of the tumor. Diana, do you have something to say here?
I would like to agree with what the doctor has said. All the stages that he has said is what I went through. So I'm so thankful. I'm more than grateful actually to say that my health has really improved. As you can see, I think from just the picture, it tells the story. Though I'm still undergoing chemotherapy, but I'm energetic. I'm able to work. I'm in the office, and I'm looking forward to my review in April. Thank you so much.
Excellent, Diana.
So, Doctor.
Excellent, Diana. You need to say that you are grateful. That's what a doctor is trained to do. The doctor is trained to do all the good for every patient, and that's exactly what we did for you.
So, Ms. Diana, can you tell us about your experience with the hospital doctors and the treatment?
I found the doctors to be so friendly and very, what word can I use that can really suit my experience? They gave me that hope, to when you hear the news about cancer, what comes in your mind quickly is that, my time is up. I have to pack and go. But from the moment I met Dr. Ashok, I had, that strong will because of the encouragement, because of how they, spread the treatment, and just how they treated me, just the care, the nurses' care. I'm just so thankful. Just from the first, from the process that I left Zambia to come to my agent, it was just awesome. So even now, I'm busy encouraging people from here to say there's hope somewhere there. Like you said treatment is affordable. Yes, I agree with you. It's just...
Also, can you share about your overall experience with MedSurge India?
The MedSurge team were, Awesome people. I remember Critica. Even now, I'm like on her, chat box, bothering her. I hear she has a baby, but I keep bothering her because she's always, handy. Once I ask for information, right away she gives it to me. There's Mohit, there's Prabhat, there's Alan. So I was treated like, a baby, like one of you people. So I'm so thankful.
Thank you, Dr. Ashok Vaid and Ms. Diana for joining us
Thank
today.
Thank you. Let me take this opportunity to thank Diana for giving us the opportunity to be a part of her treatment. And myself and my entire team and Medanta wishes you all the best for your treatment and a successful outcome of your treatment. Thank you so much.
Yes, thank you so much. I'm looking forward to my coming for review in April. I'm in the process of doing arrangements with the help of the MedSurge team, and they are on point. They are giving me everything that I need for the process, to be approved from my employers.
Early detection of cervical cancer is key to saving lives. That's it for today. Keep watching Med News India for the latest updates and expert interviews. See you next time.